If you're familiar with conditions such as headaches and allergies, muscle spasms, cramping, and even conditions such as fibromyalgia, you're aware that these types of problems are when your body overreacts and overresponds. Welcome to Live Life Well, and today we're going to discuss and review with our friend Jess how stress causes this type of response and how to better support our bodies. All right, Miss Jess.
All right.
Nice to see you again
too.
today.
I'm super short.
That's
sorry.
all right. It's adjustable. All right, you ready?
I am.
All right, hang on. It's going to lower you down. Feel that?
It's very tight up in there.
Now, this is that shoulder that you injured, right?
Yes, it is.
How'd you injure it?
I was in a really bad car wreck, and before that I had a couple injuries on it previously, but mainly a car wreck.
All right, so when you talk about a trauma, traumas change everything. Now, what's challenging with a trauma is we judge a trauma by what's bleeding or broken, right? So if something's bleeding or broken, we tend to think that's the only problem. And if nothing's bleeding or broken, we tend to think everything's okay. However, in that moment, your body absorbs a tremendous amount of force, a tremendous amount of stress and energy that can start to set up issues that we may not really realize the effects of for days, weeks, or sometimes years later, okay? And by that point, we may not really fully understand the role that trauma played in what it is that we're experiencing. Not to mention we have all the other stresses of life, those physical, chemical, and mental, emotional that build up on top of this, okay? Now, when I say stresses and traumas, stress is not just bad things. Does that feel better when I apply pressure right there?
For sure, yes.
All right. Stress is simply anything that forces your body to change, right? Like exercise, okay? Exercise is a great thing, but it forces a lot of change. And if your body's not managing that change effectively, then we're going to start to have some issues. All right, keep this leg straight for me. Lift as high as you can. Good. Take it down. And now the other side. Ooh, see how that one's tougher?
Very much.
Now, we're talking about understanding ways that stress causes our body to respond, and a big one is when that nerve system's stressed, you have two responses. You have an increase in activity or a hyperactive response, which we're going to talk about it today, because this is a focus today. Like this muscle spasm that you feel here. I know you've dealt with some headaches, hyperactive responses. Fibromyalgia is when that body's over-responding, it's oversensitive. Okay, so that's one. We recognize that with a muscle spasm, right? But it affects our physiology or can affect our physiology the same way. Or the other response when that nerve system's stressed, you have a decrease or a hypoactivity. That's where people say things to me like, Matt, I'm having trouble gripping a doorknob, or when I walk, my toe drags. Okay, those are hypoactive responses. But with you here, we're going to talk about the hyperactive. Okay, you're going to feel the table raise up just like that. All right, cross this leg over. Good. Uncross. Lift. Good. And the other side. Better. Easier.
Yes, much easier.
Now, we mentioned fibromyalgia earlier, and I can't say this is a guarantee about everyone with fibromyalgia. I'm just telling you, after seeing thousands of people over the years, a common thing I will see with people that experience fibromyalgia, when I talk about their history, there has been some significant history of physical, chemical, or mental emotional trauma. Okay? It's just a pattern that I tend to see. And so because that body is in a hyperactive or hypersensitive state, how I address those type of issues or people that their body's having that type of response, for me, is often a less is more approach. Okay? And what I mean by that, so my techniques are going to be like this. They're going to be more high speed, low force techniques. Okay? Because what happens is when you've been through trauma, if you go in and try to do too much, whether it's trying to adjust you or start an exercise program, your body may perceive another trauma and not respond well to that. Okay, have you had that experience, like trying to start exercise and everything, and like really feel like it's a struggle?
Yes, very much so.
So that's why your body's already in that overwhelmed state, so to speak, and you add something else. It's like, look, I'm not managing this very well. So I need you to stop and slow down. So that's what this instrument does. I'm helping to introduce some of the correction that we want here, but without disrupting everything. Okay. Same when the table drops. Good. Now, when we talk about hyperactive responses, that's what a headache is. Okay. It's when the blood vessels in the brain are going into spasm. It's what an allergy is. And allergies are not the stuff in the air as much as it is how your body's responding to the stuff in the air. So if it's already running in those upper limits and now it's got something else to have to manage, it's like, hey, I need you to pay attention because I can't handle all this. Lay on your back for me. Lift your chin. Open your mouth for me. Yeah, feel that in that jaw there?
Yes.
Okay, so this right here in this upper neck area, this is where your brainstem comes down. This is where a lot of those headache issues will come from, okay? Because what's located in your brainstem there is a center called your vasomotor center that's responsible for how your blood vessels expand and contract, okay? That's what a headache is. It's when those blood vessels in the brain are going into spasm. Just like you felt those muscles here, they're going into spasm. They're all drawn up and tight. Again, we recognize that with the muscles, but appreciating that it affects our physiology the same way. But that's also why you're feeling this sensitivity with the jaw. Okay. Also coming off that brainstem are your facial nerves that come out and they branch out into the face. So just like these, when that's compromised, just like these muscles can tighten up, now those masseter muscles of the jaw tighten up and become more constricted. And that's where you'll notice things like you clench your teeth or grind your teeth at night. Issues like TMJ can all be associated with these same kind of issues. Now, when you do have headaches, do you ever notice like light sensitivity or visual disturbances?
Visual, yes.
Okay. Again, that goes back to this area here because the optic nerves of the eye come right back here to the optic lobe of the brain, which is where that vision center is. So again, that system's just so stressed and compromised, but it's affecting the eyes, you know, and it's in that hypersensitive state. Okay. Make sense?
Yes.
And so, as we were talking about, stress is not just bad things. It's anything that forces change. And you and I have known each other for a long time now.
Yes.
And your life has changed a lot since we first met, correct?
Yes, you are correct.
You've seen career changes. You've gotten married. You know, these are all great things, but you've moved. They all force a lot of change. So my point is you have that history of that, you know, car accident, that trauma. But then you have those kind of changes. Then your work is a lot of technology work. You're over a desk and computer for prolonged hours. You teach piano. You're a pianist and a musician. So guess what? It's a great thing, but it's a lot of repetitive trauma. Okay, so what you feel me doing here, I'm just doing some light, gentle cranial work, trying to get how this base of your skull moving with your C1, help that to function better and move better, but again, in a way that your body's not perceiving another trauma, so it doesn't overreact to it.
Sure.
Okay. Does that make sense?
Yeah, for sure.
All right. Yeah. Feel that right in through there.
Definitely.
Okay. Feel this here, especially on that right side.
Yes.
Okay. So what you feel me working on here, because you got a lot of cranial, what we call cranial pressure here. And so you're going to feel me. I'm working on how the bones of the skull come together. All right. There's not a lot of movement there, but there is some as we breathe, as we move. And they're called sutures. They look like little teeth interlocking like that. And so as you're moving and breathing, there should be some movement there. Well, as that system gets compromised and things aren't moving well, now it's not adapting like we need it to. So that's why you feel, that's why that sensitivities are, you're getting a buildup of pressure. So what you feel me doing is working to help get that communication, get those bones moving better again. Okay. Open your mouth for me. It's a little better. All right, you're going to feel me use that instrument again. We're going to come right on the base of your skull there.
All right.
Is that sensitive right there, Jess?
Yes,
Okay.
very much so.
So some of what's going on here with your shoulder, there's a lot. This is where a lot of things come together. It's your neck, it's your upper back, it's that scapula or shoulder blade, and then those muscles come off your scapula and they come over here. Feel that right there?
Mm-hmm.
And attach to that shoulder joint in the front. So you're going to feel me work in several areas here just to help all this relate better together.
Okay.
Okay?
Mm-hmm.
So oftentimes, feel that, Jess?
Yes.
Let me know if anything's too much.
No, that's good.
People will ask me, especially in situations like this, because they're trying to find answers and why. There's a lot of different things that I'm dealing with, right? And so the question is this a muscle problem? Is it a bone problem? Is it a nerve problem? Yes. It's how all of this is relating together. Okay, we talked about you're recently married, right?
Yes.
So it's kind of like a human relationship.
Mm-hmm.
In a human relationship, if there's unhealthy communication or that system gets out of balance, then guess what? There's going to be friction in that relationship.
Sure.
It's going to get hot. It's going to get inflamed, right? That's what happens here. Mechanically, neurologically, things aren't communicating well. They're out of balance. Now things get hot. They get inflamed. And if that relationship remains unhealthy or out of balance over time, guess what's going to happen to that relationship?
It's going to fall apart.
It's going to fall apart. It's going to break down. It's going to degenerate. It's going to deteriorate. In the body, we call that wear and tear, osteoarthritis, disc problems, stenosis, arthritic spurring. These are all things that develop because these relationships have been unhealthy for a long time, okay? And so that's why getting these areas moving better is important, right? Helping them to function better, but then also better appreciating what are those things I need to do outside of here, whether it's with my exercise, whether it's being more aware of, yes, I'm a pianist. Yes, I work at a computer all day. Are there ways that I can make those work environments healthier, right? And best support myself for the long term? Because you can get these areas adjusted a few times and things feel better, but it's how can we better reduce and eliminate the stresses in our life that we can control, so now our body can better manage the things we can't control. Okay, make sense?
Yeah, for sure.
Straighten your legs for me. Come on. All right. Stand right there for me.
Alrighty.
Now, this right here, make it a little sensitive, okay?
Okay.
This is, again, some more of how that shoulder's working with your neck there.
Mm-hmm.
Turn and look to the left for me. Look to the right. Look to the left. Oh, feel that right there.
Yes,
Jess.
it's very tight.
Look to the right. Look to the left. Look to the right. Now, what you're feeling there and why it's so sensitive, it's not that I found this pressure point that I'm trying to rub out on you, okay? But the way your shoulder wants to pull, that first rib should be setting right in here. Well, that shoulder, your whole shoulder girdle is pulling forward. Well, that's blocking that movement between your neck and your upper back and the shoulder, what I refer to as the shoulder girdle. Mm-hmm. So that's what you felt me doing, help bringing that mechanically into a healthier position. And then as you're turning your head back and forth, we're trying to help coordinate that movement, that healthier mechanics with your neck and upper back, and just help take stress off this entire nerve system and structure through here. Okay? All right. Any questions for me?
I don't think I have anything right now.
All right.
Thank you.
So now, it's been a little while since you've been adjusted, so you could have some soreness. And again, that's why your body was pretty tight and overreactive. So that's why we just did some gentle things to kind of help ease that.
Sounds
All right.
good. Thank you.
So understanding that the physical, chemical, and mental emotional stresses and traumas are not just bad things, but they're anything that forces your body to change. And if you find yourself where your body's in that hypersensitive, hyper-reactive scenario, then it's how do you help dissipate that stress from the system? Chiropractic can be a big and important part of that, but there are other areas too, like exercise, rest. That's when our body's recovering from stress. Most of us are pushing the limits all the time. And then again, how do we better recognize what those types of stresses are so we can better support ourselves, so we're not just better right now, but years from now. So we hope you find this information helpful. If you do, hit the subscribe button, click the notification bell as we continue to do our best to help you live life well.